Hi, I'm Yandy Palenzuela Rodriguez. I'm a physician assistant with Infections Managed, and I'm here to talk to you today about the flu. So what is the flu? The flu is a respiratory disease. It's caused by a virus, Influenza A, Influenza B. It causes a yearly epidemic, usually around October to May. We call it the flu season. So how do people feel like when they have the flu? They get a fever, usually around 102. They get body aches, they get pain. They're very lethargic, very low energy. A lot of times they get upper respiratory infections like cough, congestion, runny nose. Now, most of these individuals will get through the flu in about 5 to 7 days and they'll be fine. However, the flu can progress to bronchitis, it can go into pneumonia. Last year, around 300,000 people were hospitalized because of complications from the flu, and there was around 12,000 deaths from the flu and complications associated with the flu. Once you have the flu, there are some drugs we can give you. There's antiviral drugs that we can give you that can treat the flu, but realistically their efficacy past 48 hours is not that great. A lot of times patients come in after 48 hours and they have to write out the flu. What we can do to prevent the flu is we can practice good hygiene, always washing our hands, especially before we eat, especially before we touch our faces. And the other thing we can do is we can get the flu shot. So who should receive these vaccines? Well, if you're in either extreme of age, either young children or adults older than 65, you should be receiving the flu shot. If you're pregnant, you should be receiving the flu shot. If you have any kind of immune deficiency, you should be receiving the flu shot. In addition to this, anybody that's a caretaker should be receiving the flu shot. These are the high priority groups. The general population should also receive the flu shot to prevent them from getting complications from the flu and prevent unnecessary death from the flu. So when should you receive the flu shot? Ideally, we want to get the flu shot at the beginning of the flu season. So realistically, before the end of October, even at the beginning of October, it's ideal to get the flu shot before you come into contact with someone that has the flu, before you get the flu, to protect yourself for this particular flu season. So where can you receive the flu vaccine? You can receive the flu vaccine at any primary care physician. As infectious diseases, part of our specialty is internal medicine, so we carry the vaccine as well. If you have any questions about the flu, or if you have any questions about the flu shots, you're more than welcome to give us a call here at Infections Managed. Thank you.